there's a lot of excitement around AI right now, as you can imagine, especially in terms of personalizing care and early detection. How do you see AI really transforming women's health over the next few years?
So it has so much potential to do that in a way that we've not had the ability before, but there's also so many pitfalls, and I think we're already, seeing that on an individual level. Again, there was a report out recently that said that the large, the LLMs that we all are all using, 60% of the answers that it's giving on a health are not accurate. So already, the ramifications of that in terms of them, the follow-up or the actions that people are taking based on that information are quite stark. And but on the flip side, we're seeing the application of AI in innovation being so promising, particularly across fertility or, looking at patterns in biomarkers, for example, and being able to really draw out insights that we've not been able to do before from these perhaps large, really messy, unstructured data sets, and give us the answers about women's health to really take things forward. So I covered Future Fertility this week, who raised a huge funding round, around $4 million, I think it was, and they're using AI for embryo quality assessment during the fertility process. So actually giving people answers much earlier in their fertility journey, egg assessment. So you can start to make better decisions with your doctors at that point of what your egg quality is like and what your chances might be through the IVF process. And the emotional turmoil that you go through when you go through IVF, if we can help to alleviate some of that earlier on, is really powerful. So that's just one example of the application of AI, but it's across all of these things: endometriosis, PCOS, menopause. It's super exciting, but as I say, the risks there on the individual level, I think, are quite worrying. And of course, all of AI depends on the data sets that you're using, and what you're feeding into these systems. And we know that if the clinical trial research is lagging so much behind for women, then there are such gaps in the data sets. And so it's
That's
really
right.
key that we're
And at
not
the
just
same
repeating
time,
history.
yeah, because at the same time, these systems aren't neutral either. They reflect the data and the people behind them. And so there are risks to that.